Dr. Connery talked a little bit about passion, so I'll indulge myself and tell you a little bit about how I got to this passion. I grew up in just a beautiful, small grape farming village. We make the Concord grapes that go into grape juice and things like that in the western corner of New York State on the shore of Lake Erie. And I grew up on Lake Erie. And when I grew up, I'll give away my age a little bit, I didn't have the internet, we didn't have PlayStations, and so I actually found myself running through the woods. And we have this creek that's 16 miles long. It goes from Lake Chautauqua to Lake Erie. The walls of the creek are 100 feet high of shale, and I can go down there. My children think it's the most magical place in the country because we can hike down there and we can camp and we can play and we cannot see another person. And as Jerry knows, I don't get any cell phone or internet coverage down there, so I can really escape from the world when I'm down there. And when I was young, one of my friend's little brothers developed kidney failure. And I didn't really understand it at the time, but he developed an illness called Hemolytic Uremic syndrome, or HUS. And I have subsequently learned that he caught that down in that creek where I like to play and I like to swim, because all of our farms run off into that creek. And so the nitrogens that go into the fertilizer and the bacteria that are in the wastes of the cattle go into that creek. And then in the summer, when the water gets warm and we want to swim in it, all of that algae blooms and that bacteria grows, and it makes it a hazard. And that was when I really realized that, boy, the environment, what's happening on all these farms affects the places where I want to play and where I want to be. And growing up on Lake Erie, I would fish in there and I would boat in there and I would hike in there, but when I was a kid, we would get days when the lake would be closed because of the pollution that was in the lake. And I'm happy that it's cleaned up a lot and it doesn't close anymore, at least not around where I live, although we were just talking recently that there have been some closures around the Cleveland area because of some of the cyanobacteria algae blooms and sometimes for the fecal coliforms around the Toronto area. And so that's how I got into environmental health, and that's why I enjoy it so much. And I was really excited to come to this conference because there are some just really great leaders in primary research in environmental health here and policy making. My son collects baseball cards. I collect the cards of environmental health scientists, and some of my Babe Ruths are here and my Joe DiMaggios, and so I'm really excited. And I'm not one of those people. I'm not one of those leaders, but what I try to do is bring their information and bring it to the patients who are looking for some answers and kind of translating it over. And so I'm going to talk a little bit about that today. And a few of the things that I say may repeat a little bit on what Dr. Paulson said, may repeat a little bit on what Dr. Connery said, and that's okay, right? Lewis Carroll in The Hunting of the Snark said, I have said it thrice. What I say 3 times is true, right? And as we learn in risk communication, messages don't get across until people have heard it 2 times or 3 times. So some of those will come through. And again, for the leaders in here, this is going to be kind of boring and things you've seen before, but I also know that we invited some people that this is their foray into environmental health. And so this is to try to get us on the same playing field. Defining environmental health can be very hard. And it's funny, after all the lectures, all the years, I still get nervous when I'm up in front of groups, so rather than trying to remember it and say it exactly right, I will pull it out. But you know, people try to come up with the definitions, and I live in Philadelphia. I've got some of my colleagues from Philadelphia. If I just hop on the public transit and go right down my street, I end up at Independence Hall. And the Declaration of Independence said that we hold these truths to be self-evident, that all men are created equal, and that they are endowed by their Creator with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. And I expand that a little bit because when I want to have a life of happiness, right, I expect that I have clean air to breathe, clean water to drink, and clean land on which to live and to play. And so that goes into my definition that you see. And so the Committee on the Future of Environmental Health tried to create a definition that you can all read. And at the same time, the World Health Organization got together. And what I thought was really important about the World Health Organization's definition, right, is that they brought in this correcting, controlling, and preventing those factors in the environment that may adversely affect the health of future generations. And so when I think about the health of future generations, I think about the obstetricians that are in here, and that's an unbelievable responsibility to bear, and thank you for taking that on, right? So anyway, let's get to the history of environmental health. Environmental health goes as long back as we can find recorded history, right? The Ebers Papyrus was written, and it talked a lot about poisoning and the environment, And probably a lot of that was on food storage, right? It was really hard to store food and to keep it safe so that you could eat it at a later time, and a lot of food poisoning would occur. But way back, thousands of years ago, we can find poisoning described. And this is a cool place. This is a trip I took to Segovia, Spain, and this is the famous aqueduct of Segovia, right? And what I think is cool, here's one of my friends who's about 6 feet tall. You can see how high this thing is in each of these kind of stone blocks. And there's not one nail or piece of glue or concrete holding that together, put together kind of the way my kids put together their blocks and finger toys, that it's still standing. It's really fascinating. And what this was supposed to do is from up the top here, this goes up to the mountains where the snow goes. And the snow melts, and as it melts, it brings the water down along the top to bring it down into the city, where the city is. And that's the way that they transport the water. And so even back here, a couple of thousands of years ago, they knew that water conducted through earthen pipes is more wholesome than that conducted through lead, right? They knew that lead destroys the vigor of the blood, and water should therefore on no account be conducted in leaden pipes if we are desirous that it should be wholesome. Well, that's interesting, right? Because in the past couple of decades, we didn't learn that in Philadelphia, and we used lead solder on our pipes, right? We can move on, and most of us learned about Charles Dickens. I had never read this book in high school or in college, but I came upon it later, right? The Uncommital Traveler. And in this, Charles Dickens describes a hunched mill worker, right? And he sees a little boy, and he asks why the woman is hunched over and looks so ill. And she says, well, 'tis the lead, sir. And he says, the what? And he says, the lead, sir. Sure, 'tis the lead mills, where the woman gets took on at 18 pence a day, sir. And her constitution is lead poison, bad as can be, sir. And her brain is coming out of her ear, and it hurts dreadful, right? Yet in the 1970s, we were still painting our children's houses with lead-based paint, right? The 1960s brought the dawn of environmental activism, and there's the stereotypical hippie van, right, out railing for the environment. And Dr. Connery mentioned the book Silent Spring, and the book Silent Spring really kind of brought public awareness to these environmental issues. She was talking a little bit about pesticides like DDT and what would happen if we had no birds and we had no insects, and you woke up in the morning on a beautiful morning like this and you couldn't hear the crickets chirping, and that nature was really vulnerable to human intervention. And it was fascinating when you read the history of this book and its publication, and how industry had to come out and write books to kind of defeat this book and say, what would the world be like if we didn't have pesticides and malaria running around? And so obviously there are some balances that we need to go to. And I think it's fascinating that it's in my lifetime that the Environmental Protection Agency was developed. I kind of thought it was around forever, but that's not really true, right? So in the 1970s, I read this book by Edward Abbey, The Monkey Wrench Gang, and so I was one of those hippies in those vans railing out against the machine to try to save the environment, and my life has changed a lot since then. But still, the environment is very, very important, right? And so where are we today? Well, we see the environment in our world every day. If you open up the paper, I didn't grab the Washington Post this morning, but I'm sure if I open it up, we'd find something in there, right? I live in Pennsylvania now. In Pennsylvania, they're looking for new sources of gas, and they're drilling for natural gas, and they're doing this hydraulic fracture drilling. And so now people are worried. What are these chemicals we're pumping into the ground? How are those chemicals getting into our water? What is happening with that water when we have to drink it? And as Dr. Connery mentioned, it seems like the burden of proof is on us, right, to show that we're getting sick rather than them to tell us that they're going to keep us healthy. A few years ago, the USA Today published this big report about all the drugs found in drinking water, right? And that was a big moment. I had to explain. What was really fascinating, right, was in Philadelphia, we had 52 or 53 pharmaceuticals found in our drinking water, and in that bastion of cleanness, Los Angeles only found 3. So I had to say, well, why did we have 53 and they only had 3? Why is Philadelphia so much dirtier? And it really came down because we analyzed to the part per billion level, and in Los Angeles they analyzed to the part per million level. But it was still eye-opening to find out that that water that we're drinking out of our taps has oral contraceptive hormones in it, has anti-epileptic drugs in it. And what does that mean? Now, I was a biologist as an undergrad, especially studying freshwater streams and limnology. And the answer that we always got was the solution to pollution is dilution, right? And that's probably true up until a point. And where does that point exist? Right? We can think about plastics and baby bottles and those linings of cans. And one of my colleagues went around Chinatown in Philadelphia with his X-ray fluorimeter gun and looked at all the little pretty plates and mugs and shot them up and found that a lot of them were indeed painted with lead. And that was interesting to me because growing up in upstate New York, I was an avid Buffalo Bills fan. And one time I made my dad go and get 8 gallons of gas so I could get my Buffalo Bills drinking glass. And a week later, it got taken away from me because they found out that the Buffalo Bills logo was painted in lead and I wasn't allowed to drink from it anymore. So I'm still shaken by that. Dr. Connery showed a stat about 8,400 chemicals, right, or 84,000 chemicals. Well, the Chemical Abstract Service takes the job of kind of naming and assigning a number to every kind of compound you could ever find, kind of like we identify genuses and species of organisms, right? And they now have 73 million chemical structures that have an abstract number. And they suggest that 68 million of those are out there in the world somewhere, right? So there's a lot of them. And there's only regulations on about 280,000. Some people think that, boy, we're really failing. We've only regulated less than 1%. Of course, then when you realize what it takes to make regulations, the fact that they got 280,000 regulations through is really an amazing feat. But I think we understand that exposure to poisons is a daily occurrence, right? My wife recently got her new Ford Flex, and we got into it, and she remarked that she loved that new car smell, and I just chuckled to myself. Dr. Connery mentioned the measurement of chemicals in pregnant women, right? And the CDC and Dr. Mortensen, who's in charge of this program, actually looks at the National Health and Nutrition Examination Survey and is able to monitor different drugs and chemicals and pollutants in the blood and the urine of healthy people. And they now report on over 148 of them. And it's a great resource. It's on the web. There's the link. The link's in your handout. If you can't find it, you can just do CDC National Human Exposure Report. But I think it's fascinating. You can learn like how much of that pesticide that's in your dog's flea collar is actually in people now, right? And it's really, really pretty amazing. But our environment is more than chemicals, right? Our environment is all encompassing, and so it brings into climate change, and how does climate change affect us? It brings in stress, and as Dr. Paulson mentioned, I'm a pediatric ER doctor, and what I've really noticed in the past 20 years of practicing in my pediatric emergency room is how much more of the illness that comes in every day seems to be related to stress and be stress-induced illness, and how that affects us and how that changes our immune function and our endocrine system. Sleep cycles and nutrition are very important. Our built environment and how we build our communities and how we do or don't make sidewalks and where we put our schools really has a great impact on the health of our children and whether they get hit by cars and whether they get exercise and whether they feel safe. And we learn about radiation, and people have concerns about the cell phones that we put to our ears, and we have allergens, right? And we've learned that children are unique, and I stole this concept from a great slide set produced by the World Health Organization on environmental health. And so for any of you that are new in environmental health and think, boy, I'd like to go back to my residency program and create a little lecture, you can search under the World Health Organization Environmental Health, and they've got like 100 slides preset for you that you can just kind of put out, take the ones that you want, and lecture with them. It's awesome, right? And they point out that in a lot of paintings in the 13th century, children look like miniature adults, right? You kind of take a look at that baby. Boy, he's kind of gruesome, right? He's got his full beard and his little teeny head. And it's interesting because as we look at what traditionally has been done in environmental health, and when we're trying to decide what are the risks to pregnant women, what are the risks to babies, we've taken some data that we've had from occupational exposures with adults and just tried to extrapolate them down linearly. And that doesn't always work, right? And as we came into the renaissance of painting, they started to paint children a little bit more realistic. This one still has a big head of hair, but you can see that he's got a big head and those stubbly little limbs that children have, right? And maybe as we've come to this renaissance in environmental health, we've realized that their differences aren't just anatomic. And we have learned that children are uniquely susceptible to a lot of these things, right? And they have probably a much greater vulnerability to these environmental influences. And that Vulnerability is in the preconception phase, right? It's in the fetal phase, it's during childhood. Children do have different and unique exposures and pathways, right? The fetus gets exposed through the placenta. The baby gets exposed through breast milk or through bottle milk. Children play on the floor, they climb under the table where I rarely go. And so all of those exposures can be very different. They have an increased metabolic rate that can be important. They have different metabolic pathways that we learn about. The way that a young child metabolizes a drug like acetaminophen is very different than the way that an adult does, right? And that physiology changes throughout development. And children also have a long life expectancy. So whereas if you hurt your neck and you go to an adult hospital, they don't think twice about doing a CT scan of your cervical spine to look to see if you have a fracture. But in my pediatric ER, we never get a CT scan of the cervical spine if we can avoid it, because the radiation to the thyroid gland over that child's life expectancy of 80 years is much more significant. And it brings in this key concept of there are windows of susceptibility or windows of vulnerability. And everybody learns about this in medical school, and especially people that go into obstetrics learn about things. And Dr. Connery mentioned DES, and we can talk about thalidomide, right? We know that in the first trimester, everybody in their medical textbook of embryology had that big chart I have up there on the right, so you don't really need to look at it for anything important. But we know the first trimester is the time when the limb buds form. And so if you got this drug called thalidomide, you might have the problem shown in that little baby where your limbs wouldn't form, and you get this teratogenic illness called phocomelia. But if we gave that drug in the third trimester, those limbs were already formed, and so you wouldn't have any bad effect whatsoever, right? And so there was a period at time when the exposure was important. And that may be true for a lot of environmental susceptibilities. There may be a period of time when the exposure is very important. And so that takes us to teratology, right? And so in classic teratology, we have a clear exposure. You were prescribed thalidomide. We have a clear morphologic change. You have phocomelia. That's apparent at birth. Everybody can make the link. Exposure, something bad, teratogen, let's eliminate it, right? But in what we're now seeing is environmental teratology. It's much more insidious. These exposures might be invisible, right? Nobody knew that they were drinking bisphenol A or phthalates or polychrominated flame retardants, right? The disorders may be latent. They may not show up until much later, like type 2 diabetes, right? And now we're even learning that they might not even be an apparent in the person that had the exposure, but they might even skip generations and affect future generations, right? And that led one of the directors of the National Institute of Environmental Health to say, boy, if thalidomide had caused a 10-point loss of IQ instead of these obvious birth defects, it would probably still be on the market, right? We all think of it as being a bad drug, and it's bad because of that, right? In 1989, a seminal paper was written in The Lancet. It was written by Dr. Barker and his colleagues, yeah. And they took health records from the Public Health Service in Great Britain and looked at birth weight of children and then followed them until adulthood to look at to see if they had cardiovascular disease or coronary artery disease. And they found that indeed the children with the lowest birth weights had the highest incidence of coronary artery disease. And that led to this idea that if low birth weight was based upon nutrition, was it possible that maternal nutrition and fetal nutrition somehow had a role in the development of coronary artery disease later in life? And that database has been used to look at this in a lot of different ways and has really come to the understanding that there indeed are developmental origins of health and disease, and that fetal nutrition and fetal exposures can have lifelong implications. And that brings us into these new morbidities, right? I have a cool textbook of pediatrics written in 1934 at the Children's Hospital of Philadelphia where I work, and it's very interesting. Most of us know about croup, and the #1 cause of croup in 1934 was diphtheria, right? I've never seen a case of diphtheria. We've conquered diphtheria in a way. We've more recently conquered Haemophilus influenza type B, and a lot of those things that were our standard morbidities have disappeared, and people aren't seeing, and doctors aren't seeing. And that's true. I can come up with 100 or 1,000 of those in pediatrics of things that my teachers saw that I didn't see, that I've seen that my students don't see, and I'm sure that happens a lot in obstetrics too. But now we talk about these new morbidities, right? There are all these new diseases, and Dr. Connery showed lots of slides on that. And does the environment play a role, right? There's endocrine disruption. We're seeing increasing rates of obesity. We're seeing increasing rates of diabetes. We're seeing people sexually mature at younger ages. We're seeing increasing rates of hypospadias. We're seeing increasing rates of frogs that have the third leg, or you can't tell if they're boys or girls, right? And we're seeing increased rates of endocrine-sensitive cancers. And why is that? And does the environment play a role? How about neurocognitive development? We're seeing increased rates of autism. Certainly there was a lot of great concern and debate about some of the chemicals and some of the constituents of vaccines and whether they might play a role. We're seeing non-autism developmental disorders on the rise. Lots of people diagnosed with attention deficit hyperactivity disorder and lots of people with depression. And could the environment play a role? How about lung and immune development, as we're seeing increased rates of asthma, we're seeing increased rates of food allergies, we're seeing inflammatory bowel diseases. When I talk to my colleagues that treat the inflammatory bowel diseases, it's fascinating, right, that those diseases largely don't exist in the agricultural world, but they do exist in the industrial world. So they're diseases of the United States and Canada and Australia and Great Britain, but they're not diseases of Thailand and Cambodia and places. And so is there something that we have done to over-clean our world to change our immune function in this hygiene hypothesis, which I think is really fascinating. And so it's important to know that each individual has a genetic makeup, but what that genetic makeup, how that genetic makeup is expressed depends upon the context in which it's read. And the environment provides a lot of the context to how we interpret our genetic makeup, right? And it's like movie reviews. So if you have Siskel and Ebert and they say it's on my top 10 list, that's great. They can say that over and over. But what if their whole quote is on my top 10 list of worst movies of the year, right? That changes how we interpret that top 10 list in a great way. And we can change how we interpret our genetic code based upon our environment. How do we do that? Well, there's this field of epigenetics, which I think is fascinating, and I don't understand it completely because, like, once again, I went through medical school at the wrong time, and people now are learning about this earlier on. But what we know is that we can modify these histone proteins, and those histone proteins can connect to our genetic material and turn on or turn off the reading of the genetic code that's there. And we can methylate, put these little methyl groups onto our DNA, and that can change the way our DNA folds, and so it can lead to genes being expressed or not being expressed. So indeed, something I'm exposed to that methylates my DNA that I can pass on through my sperm and my wife can pass on through her eggs and can go to our children can change the genetic interpretation of our children and potentially the illnesses that they have, right? And I think it's fascinating because I think of this as being something that the young kids learn about and that I didn't know about and that I think is really cool to read about now. But then you go back and you see that epigenetics was defined by Dr. Waddington back in 1942. So this actually did predate me. I wasn't even alive in 1942. But we did find it. Even then they knew there was a branch of biology which studies the interactions of genes in their environment and how the environment can change that phenotype and how we bring it into life. So where are we at? Well, I'm a pediatrician, and I kind of despair where I'm at as a pediatrician in environmental health. And the theme that I've caught on to this year is that I'm always one step behind, right? What do I mean? Well, let's take a look at the pediatric approach to lead poisoning. And there's a picture of a house with lead-based paint and the way it kind of flicks off like that alligator skin. And the x-ray to the right, you might be able to see some little flecks because that's a child who's taken some of those flecks of lead-based paint and eaten them. However, for a lot of children, it's just they'll find lead dust and you don't see them eating it. And what we do is we take children and we say we're going to screen them with a blood lead level, and we do it at about a year of age. And then if it's elevated, we try to figure out what to do. And that's a little girl that I took care of at my hospital, and she was screened at 1 year of age and had a blood lead level of 200 micrograms per deciliter, right? So very high. And I was one step behind, right? What I wanted to know is, am I actually 21 months behind at preventing neurologic injury, the 12 months she's been alive and the 9 months that she was a fetus? And I was, right? I was that far behind. So if we want to get ahead of this, obstetrics has the chance to get one step ahead. And let's think about lead some more. We know that lead lives in our bones for a long time, takes a long time to excrete. So the exposures we have in children stay in our body and stay in our bones as adults. When we become pregnant, we mobilize that bone. We get a lot of bony turnover. Some of that lead leaches out. Lead crosses the placenta. Lead injures the developing brain. And the CDC has some nice publications regarding the testing of lead in pregnancy, and they can be found at that website. And the American Congress of Obstetrics and Gynecology also has some nice follow-up recommendations to that document that I'd encourage everybody to look at. So environmental health is very complex. We live in a polluted world. Sperm, eggs, fetuses, and children are vulnerable to their environment. And unfortunately, we don't yet understand the impact of most environmental influences on child development, and we don't have those randomized, double-blinded controlled trials, and it makes it really hard. So there's so many environmental exposures, so many health effects, and we know that environmental health is underrepresented in medical school and residency curricula. So I think our goals today, or at least for me, is to foster collaboration between obstetricians, pediatricians, and environmental health. Get all of you guys working together, and at the break that's going to kind of come up after this talk, let's talk and let's figure out how we can work together to bring this to the forefront, right? Let's develop some curricula for medical students and for obstetric residency trainees so people understand how important this really is to the future generations. And let's protect our future generations. And at the end of my handout, I'm not going to show them. I have my typical disclaimer slides, and I don't really have any financial conflicts of interest with anything I do. But I do have a couple of personal conflicts of interest because I have 3 children, and I want them to have grandchildren, and I want them to be healthy. And that's my conflict of interest and why I'm here, right? So thank you. I hope you enjoy the rest of the conference. I think we're going to break after questions for like 10 minutes and a little bit of coffee. And this is how I'm going to answer anything you ask me now. But I'll take any questions. All right. Oh, yeah, sorry.
Can you say a little bit more about how that map of Lancaster County was created with the lead hotspots? I mean, what kind of screening went into that? And
Sure.
Was it public health or?
Sure. And to Dr. Paulson's request, can you mention where you're from?
That's right. I'm Kimla McDonald, and I'm a midwife. I work at GW.
Oh, great. Terrific. Yeah, so actually the major health system in Lancaster County is based around Lancaster General Hospital. And through a very active community advocacy program in Lancaster County, they actually were able to get some grants to get some lead testing equipment and put it around. And so all of the health groups that are inside that Lancaster General area started to do routine lead testing, mostly on children. And most of that map was built from children, but it's not exclusively childhood data. I feel bad because there's anybody from Pennsylvania that remembers Franklin and Marshall University sits within that area too, and they have a very active coursework on environmental justice, and they have a professor who's very interested. So he gets a group of 20 or 30 undergraduate students with great interest in environmental justice who keep this going, and they go out and they do education, and they go out and go to health fairs, and they actually recruit big groups of kids to come in for lead testing. And so through that, they've been able to do this mapping. And the University of Pennsylvania has a Center of Excellence in Environmental Toxicology, and so this Franklin and Marshall University, the University of Pennsylvania, this Lancaster General Hospital have all gotten together to create this. Lancaster County is interesting because it does not have its own health department. It's completely under the auspices of the state of Pennsylvania Health Department, which is a little bit unusual for Pennsylvania. So that's how they came to it. Yeah.
My name's Eva Cantor. I'm a resident at Lincoln Medical Center
Great.
in near Philadelphia, and I was curious, and you might not know the answer to this question, but does the population in those lead hotspot areas, are they aware that they're in a lead hotspot, and can they bring that to the attention of their obstetricians or pediatricians?
Great question. And so the question was whether the people that live in those hot spots are aware that they're in those hot spots. And there has been some effort to reach out to them and let them know. And certainly there's been great effort to let the primary care pediatric some of the areas in those more rural areas with a lot of the Amish families, it's been difficult to get that word out. But there are efforts in that regard. Yes.
Same theme, John Larson from GW. You must have some hypotheses as to where tactically the lead is coming from in those farming communities.
Question is, do we have some hypotheses? There are actually a lot of hypotheses, and you know, a lot of those homes in those farming communities were built in the 1800s and early 1900s, and so they're old homes that have lead-based paint on them. A lot of those farms have two farms. They have their commercial farm, which is out in the big field, and they have their home farm, which lies right underneath the water droppage of the roofs of their house. And all the lead-based paint goes down into that soil, and it's the area where they till and the children play. And so they have some of the same lead dust exposures that everybody else does in those areas. And there are also areas that are much more likely to do all renovation, remodeling, and scraping by themselves. What's also very interesting is looking at who the homeowners are in the Lancaster city that's in the center. Most of the people that live in those homes that have lead poisoning in that central hotspot are renters. The people that own most of those properties live out in those other hotspots that I showed you. And they actually will go in, renovate those homes, take all the refuse from that renovation and bring it back and dump it at their own homes at their sites. And there are lots of other kind of thoughts that go into that.
So the focus of the investigation then is on the old lead paint and where it's been and where it's going and how it is getting in. It isn't as if there is a new lead being introduced into the culture and the environment through some inadvertent use of lead-based
Correct.
ceramic paint.
Right, yeah, that's been examined a lot. Right. Although there are a lot of people in this room that could talk about all of the new ways that lead come in all the time through our pediatric environmental health specialty unit. We were just advising a family who were importing spices from India to make their own Indian food, and those spices that they brought in had a lot of lead, and there are lots of different exposures, but almost everything in Lancaster County, along those river areas, it's industrial, and everywhere else it's the old homes from the old homesteads. Yes?
So, sure, Steve, our Baylor College of Medicine. So I'll just throw this out there, but I just got back from the International Human Microbiome Consortium, which is another aspect of what our research focuses on. There's actually some very interesting data coming out now about the role of halophilic bacteria in metabolizing lead. And so one of the ideas that a number of us are trying to go out there with is actually our use of antibiotics, especially in farming communities, on animals that we put so much antibiotic in animal feed, actually has now created a situation by which we have the normal bacteria that's been responsible for absorbing heavy metals, and it's not just lead, cadmium is another big example, no longer as populated as they once were, and the sequelae of that is that we have a lot more circulating lead and cadmium levels. So it's not just paint or what's been put out into the environment, it's actually such a long stream effect of ongoing commercial use of different things that's why it gets so concentrated in farming communities.
Right.
And looking for primary source leaching in lead may not get us to the answer we really want to get.
Yeah, great points, fascinating work. So there are lots of susceptibilities and vulnerabilities, and I certainly didn't mean to get this talk going off onto lead because there are a couple of the world's experts on lead in the crowd that can do a much better job than that than I can. But certainly it's among one of the many things we need to think about in our environment. So, all right, well, thanks again, and I'll see you out around the coffee.